Okay, so we're going to talk about wound packing. So this particular device here has several different types of holes. You can see how this one looks. This is more of a laceration. This one's a little more jagged. This is the one that I'm going to use for this particular setting. All right, so obviously this will be actively bleeding if we were going to be packing it, but this is just to show you the process. So this is going to be the roller gauze that we're going to use, and to be able to get ready and pack it, we're going to pull from the middle piece here to be more actively ready to pack as we get ready to do that. So if this was actively bleeding and we had blood gushing out of it, we would want to kind of scoop some of that out so that we can get this as close to the vessel as we can, especially if this has like hemostatic embedded into the gauze. Okay, so if it was actively bleeding, we would go ahead and get started with this. We would again scoop that blood out, and then we're going to start packing. And you can pack as much as you can. You have to do this kind of quickly, especially if it's bleeding a significant amount out. Once it's completely full, then you would take what's left of this and push and hold on the outside. If it's impregnated with the hemostatic agent, then you want to hold it for 3 minutes. And if it's not, then you want to hold it for a minimum of 10 with significant pressure there.